We can open the floor now for questions. Um, Morgan, I don't have anything yet. Are you getting stuff online? No? Okay, well, that's great. We can focus on the people in the room then. So if you're near a mic, just queue up a mic, and I'll call on people too. And if you're not near one, raise your hand or something, and Morgan will get you a mic. And maybe introduce yourself again when you ask the question, just so people online will know who it is.
Great. So I'm Robin Hogan from the Robert Wood Johnson Foundation. So I flew all night to be here. I took a red eye from San Francisco because I thought this was such an important meeting. And I really wanted to be here personally to salute the leadership of Dr. Feinberg. And it occurred to me, if Mike Bloomberg could change the laws of New York to get a third term, maybe Harvey could change the rules of the IOM to keep this project going and maybe have another 10 years of leadership here. Because I do think continuity of leadership is really important for a project like this. The Robert Wood Johnson Foundation is all in. We think this is brilliant. It absolutely tracks a conversation. It's been going on at the foundation for the past year. So a culture of health is the sort of the mantra that we're going to be marching behind for the next 10 years, probably. We need to move from a culture of violence. I think the tragic shootings in the Navy Yard, they're up to 12 deaths now, is just a tragic reminder of how far we have to come to move from a culture of violence to a culture of health. So I think it's just a reminder how steep a cliff we have to climb up together. I just want to make one observation. So that we were very proud of our sponsorship of the Addiction series, John. It was great work. It predated my time at the foundation, as you know. But that Emmy's in our lobby, and the film plays on a loop. So if you've been in our building recently, you've seen Addiction playing ad nauseum. Because one of our board members is so proud of it, said, you should play that film all the time. Every visitor should see that. So there it is, it's playing, and we're promoting your work. But we passed on The Weight of the Nation, and this is why. I can barely lift this. This is 8 hours of video, and it's stunning, but it's heavy, it's weighty, and it didn't end up in being bits and bytes, John. I wanted to see 200 90-second sound bites because we live in the 140 character generation, right? So everyone's looking for that tweet of the day. And you can't tweet 8 hours of video. So I think I was disappointed that HBO didn't take the extra step of cutting that up into those extraordinary interviews. I mean, it's powerful, compelling. I watched 8 hours of it, and I was deeply moved, but I don't think a lot of my friends did. And so I'm just concerned that we don't do another 8 hours of A Healthy America, but look at the 2-minute version, and then do another 2-minute version, then animated 2-minute version, then do one in Spanish, then do one in Arabic, and just keep telling the story over and over, but with hundreds of different storytellers. So you sold us. We applaud this. We're looking forward to engaging with you in a very serious dialogue about next steps. But I'd like to think that in this day and generation, that there's a different approach than 8 hours of tape.
Well, I'm very glad you asked that question because it's very important that we disabuse people of the notion that A Healthy America, in terms of a product that comes from my leadership, is another in the series of definitive encyclopedic looks at either addiction, Alzheimer's, or obesity. A Healthy America is not. We're trying very hard, and if we're not succeeding, we have to try harder to have people understand that this is a marketing campaign, that we are marketing health, and it's using all the tools of the marketing trade to capture the public's attention. And as I tried to talk about with this notion, this analogy of the helicoptering in. I see that what we did on addiction, Alzheimer's, and the Weight of the Nation really was in that helicopter sort of model where it was an event. We have to also remember that the platform was HBO. It's a television network. It is driving viewership to a long-form model of content. So A Healthy America is content of all lengths where appropriate. So it is driven first and foremost in the public's mind by short form or print. So it is all the most current technologies, using all of those technologies. But we also we can't forget, and I think Megan was alluding to this in some of her comments, that these are complex issues. And one of the strengths that I think that we have is the ability to help people understand complex issues, and that we can't shy from the complexity as part of our mission to help people understand, because some issues really require the deft hand at helping to communicate to people about issues about the brain, how the brain of the addict, what is changing in the brain of the person struggling with Alzheimer's. Sometimes you need that time to really help people understand, and that's been something which I think we're very proud of and been recognized for, is our ability to help people better understand complex issues. So in our materials, we try to convey that A Healthy America is going to exist wherever we can. And I think it's maybe a good time to talk a little bit about I talk about this mighty coalition, but part of what we're doing with A Healthy America, and this work is beginning very soon. You're coming to a meeting here on October 8th for that. Some of the other people in the room will be there. And Harvey, please join in at any point to talk about this. David and Ellen, you too, you're playing leadership roles in this. But we're going to be convening a series of summits. The IOM, I shouldn't say we, the IOM is going to be convening a series of summits over the next year to bring together leaders from all different sectors of society, from the health sector, from the academic sector, and from entertainment, from media, and the largest manufacturers, the largest employers, the major marketers, to build this coalition that we talk about, to solicit their expertise, to solicit their support. But I'll talk this is getting back to your question, this is just setting the scene, but getting back to your question about the forms of media, we need to bring together the major media platforms. So that's bringing Mark Zuckerberg to the table. It's bringing Twitter to the table. It's bringing the entertainment sector. So it's bringing the Disney Channel, and it's bringing CNN. It's bringing Black Entertainment Television. It's bringing Univision. And having everyone make the commitment to maximize on their platform their commitment to A Healthy America. So if it's Black Entertainment Television, there should be a series of PSAs and a commitment to use that platform to communicate about hypertension. There should be a documentary on Black Entertainment Television that is shown regularly about hypertension. So, but we should be working with Twitter to support that campaign. So A Healthy America, 5 years from now, project ourselves into the future when we are ubiquitous, is existing across many, many different media platforms simultaneously. So that's an audacious goal, to believe that you're going to bring all these competitors to the table. But we're making the proposition that the alternative proposition of not acting is so serious for the nation that we have all the evidence. We know the consequences. There's not one economist who's not working from the models, of OMB, et cetera, that show that the consequences are dire. So we're just saying, how do we really drive the conversation? How does the IOM use its power to convene to drive the conversation about what corporate America is going to do in terms of its commitment? And we're trying to start the conversation here about what is the philanthropic community going to do to kickstart this, get it going.
John, could you
This
talk?
is Gail Ober. If I could add that one of the reasons the George Family Foundation became engaged at the very early part of this is because we recognized, after talking with both John and Harvey and others, that this project wasn't going to start and end in a year or so. It was really a very long-term commitment. I think, John, on one of the phone calls you mentioned to us, it's been 30 years we've been talking about stopping smoking in this country and reducing smoking, and it's a lot of public policy in there as well. But certainly, we don't expect to get this done in a year, and it was that realization that it was not going to be a couple series or a few movies here and there that were really going to change this, but a long-term commitment on a lot of media vehicles across the country that we're going to make the change.
John, two questions. So one is a question from online, one is my own question. So my question is, or request is, if you could talk, say I'm a local funder, a bit about how you would see the role of, say, state level or even county level funders in this coalition that you're building, like how they can play a part. And then the question from online is if you can talk about how you're going to measure the clinical impact of a Healthy America, a la Dell Foundation.
I want to, invite my IOM colleagues into the answers to some of these questions, because this is these are some of the measurement questions are eternal, and they in measuring, and Ellen, if you want to join in this conversation as well, but the measuring of the impact of media has been a question that has been ever present whenever these kinds of efforts are being discussed. And there are some tools. We need more powerful tools, but there are efforts that are going on now. Knight Foundation and Gates Foundation are supporting some very interesting work that's going on at USC in trying to develop more powerful means of using digital media to really determine the impact that public health campaigns are having. So I'm going to be very simplistic and say our aim is to bend the curve on chronic disease. We recognize that if that is our ultimate goal, and if we want to believe that media has a role to play, it's not that it can't be, it's unfair to hold it out as the single force that will shape health outcomes in this country. But that's our aim. Our aim is to, 30 years from now, be able to look and say, we have a headline like what we had here, where we're seeing a return to 20th century levels, mid-20th century levels of chronic disease. So how we measure our impact and our success along the way, the money that we're raising now is to work with Susanna Fox and others who are struggling with these questions to come up with very sensitive tools to measure these. So we have to build the relationships, and the IOM as a part of that, with the investigators who are really looking at this question. People at Annenberg, at Penn, are spending their careers asking these questions.
Faith, could I add a word? I wanted to comment also on the question, what can you do if your interest is local relative to this idea of a healthy America? We're never going to have a healthy America unless we have a healthy Cincinnati and a healthy Savannah and a healthy Birmingham and a healthy Seattle and a healthy Minneapolis, or maybe, Gail, I should say an even healthier Minneapolis. The point is that this is going to succeed if it does succeed, and to the degree it succeeds, if we're working at it simultaneously at the community level, at the city level, municipal level, county level, state level, and national level, because all of those are mutually reinforcing. A campaign in Cincinnati will be easier when there's a successful Ohio program. And Ohio will have its program greatly facilitated by a national environment that is reinforcing the core messages. I think that over time, moving toward a culture of health in America means introducing healthy lives and life choices in communities in every part of this country. And so if I were a neighborhood organization and supporter, I'd still have a way to be part of a healthy America. The measurement question is a really tricky one, as everyone knows who's ever made an effort. It's a question that corporate America grapples with, invests enormous amounts in, and in the end often goes on its convictions and beliefs without the kind of evidence that a scientist might desire before publishing a paper. There are things we know we can gain, and we know we have to try to do that. I can tell you, and Megan was talking about the difficulty of persuading individuals who are oriented toward data about convictions about stories, and that stories will work. Imagine a whole set of scientists and experts whose lives depend on ignoring anecdotes in favor of evidence, coming around to the appreciation that once they gain an understanding of what is true from facts, that the way to convey it is nevertheless through stories. And that's a really important capacity for those of us who start from a more scientific or professional standpoint to appreciate. So I hope that we will be able to take advantage of everyone's best experience and expertise as we go forward. And that is going to mean using the social media. It's going to mean learning from the experiences and choices of companies all over this country and elsewhere. It's going to mean the expertise of marketing and communications people. It's going to mean the entertainment and media expertise that we want to tap into more deeply. So we hope there'll be a place for all of these players and all of these participants as we go forward.
I just want to add one final point to the question of community level foundations, and it has to do with the creative process. I think there's one more way that Megan alluded to, and John also sort of touched on when he talked about storytellers, which is that we recognize that many of the community foundations are sort of almost exclusively involved in on-the-ground work, and part of what we would love to hear from community foundations is what is working and how can we weave those stories into our storytelling. So I think that there are so many ways that different organizations and foundations can contribute to what we're doing, and one of the most important ways is to give us your stories.
I just want to very quickly follow up on that. I had lunch with Peter Long from the Blue Shield of California Foundation just this week or last week, and I was telling Faith about this conversation. Peter Long, who is one of the board members of Grantmakers in Health, is very familiar with what we're doing, and we're very fortunate to have some of his inspired guidance. And Peter really inspired me to think that we have to establish, a mechanism to communicate back and forth with the community foundations. We need to be learning from you, as John says, about these stories. We need to develop a mechanism where, we are learning about best practices that are happening in communities. That's our capacity is to magnify those, and so we need and to build into the infrastructure of a healthy America a really vibrant sort of communication tool that will be a permanent part of how a healthy America not just gets born but lives its through its duration, that we are learning from you, and then we're able to package that and work with the best creatives to turn that into compelling storytelling that works for that community, but then ideally really works for many, many more communities. And there are going to be, the need will be so great to tell so many different kinds of stories because we're a complex nation and we're a complex population, and many of us have very, very different needs. And we have, if we're going to be successful in Healthy America, it's recognizing that diversity of experience from the get-go.
So, John and Harvey, I think this is, really the right approach. But I have the question I have is when you talk about chronic disease, are you really going to be looking at, more than obesity or more than tobacco? Because I think there's issues around asthma that I think get neglected sometimes in this. But the other one, Gail mentioned civic engagement, and I'm just wondering in terms of the call to action, whether there will, how you're going to be thinking about that particular issue, because, one response could simply be, I need to live a better, healthier life. But another one might be, I need to make my community a healthier place, which means addressing things, like policies or how the built environment is planned. So I was just kind of wondering how you're thinking about that.
Just to respond on both these points, one of the exciting and critical needs that we have is to formulate priorities and foci as we go forward. We know we cannot cover every possible condition and every possible cause. We do want to use and be guided by the burden of disease and by the nature of key causes to be able to get the most benefit from the investment that we want people to make in their own lives and health. Fortunately, many of the same interventions around healthy communities, around personal life choices, around preventive strategies actually work to the benefit of many disease prevention goals. So it's a relatively, we can focus on a relatively smaller number of actions and policies and see the benefits extend out to the prevention of many different disease problems. And so that's one comfort in this that I think we can take. I do believe that we're going to have to work very, very carefully, very critically to be sure that what we do over time makes good sense from the vantage point of impact on health, and that's going to be the guide that I think we have to use constantly ahead of us.
I think that if a Healthy America, if one of the most important things we do is really change the conversations or change the perceptions that people have about the values associated with good health. And so I think that if we can really impact the way that health is viewed in many, many sectors of society as a fundamental human right and value, then that can hopefully shape the kinds of conversations. If we are driving a shift in the values of the population, I think that it's our hope that by impacting not just knowledge and attitudes, then getting to values, and ultimately, yes, we want to impact behaviors, but if we even get from knowledge to attitudes to values, then I hope that we're making the job for others who see it as their first and foremost priority to try to improve the rules, the regulations, the laws, that we're easing the path for others to go down because they're operating in a culture that has a very, very different view about health and what a society, what a truly civilized society has, and a society as rich as ours, how we value health. So I think that that's one way.
I have a question from the online audience. Are there plans to deal with the role of food and other advertising in shaping the information environment in which we live? The evidence on some aspects of this is strong.
Yes. Exactly how? Exactly how it fits into the kind of strategic communication that we've been discussing. That's part of the planning effort and the decision-making that we need to go through in this first phase. But in my mind, everything that matters to health is on the table. And where we can make the most difference is the guide we want to use as to where we focus and the means we employ to reach people with those messages.
And you have IOM reports to support that.
Indeed.
I think many of us, I know I do, listen with our own filter, right? So we all have our own agenda and the problems that we're trying to solve. And Tony, I was incredibly struck when he was talking about the notion of changing the definition of health. And one of the things that we've seen over the years in all of our outreach, and have a lot of data that we will happily give you guys, is that for many people in the United States, the biggest diseases I think that they would, if they knew to use this language, would be that they would describe would be things like being a caregiver, or financial stress, or relationship stress, or workplace stress. And often when we reach out to somebody and say, get your mammogram, go get your colon cancer screening, go walk more, we very rarely get back from somebody, I don't believe in it, I don't think that has value. We almost always hear with genuine, like, torture, I wish I could. I just can't prioritize that right now. My husband just lost his job. My mother just moved in and she has Alzheimer's. Susanna and I talk a lot, and Pew has a ton of research about this, that, caregivers are really the unsung heroes of our country. And I think one of the things that's missing, and I don't know anyone who'll do better at this than you, John, in the messaging around health is to start with empathy. It's not that you're all just idiots, right? Which I think comes across a lot in the way that the healthcare system communicates. Like, if you just were smarter, you would make better decisions. I make bad decisions all the time, and I think I'm pretty smart. So how can we, A, address the expansion of the definition of health to include some of these life factors? I hope that we are. And B, can you just talk a little bit about the role of empathy and how that might play out in this?
Well, I think it is, in some ways, it's a similar answer to what I also gave to David, which is that it is in the way that we communicate, the way the stories are told. It's the choice of characters. It is the design. It is, and when I talk about the creative process, it is having you at the table, so that, and many others, so that the creative people who are crafting the message are steeped in this, they have convictions, and they know that it's part of the program, it's part of the assignment, okay? And that their success is going to be measured by the ability to capture many things at once, to communicate a variety of values at once. And I take that as very much the challenge of throughout my work. And there are many mechanisms that we can use. Susanna's kind of research. I mean, every time we meet with Susanna, she has new data that is so illuminating about how people are thinking about their health. But there are many others who are doing this, and we need to access as much of that. We need to commission it. We need the resources to commission this kind of research, so that we are, one with the pulse of the nation on these given issues. I talked about my own experience of sensing, a moment that was happening in Nashville. We need to sense if there is a tipping point. I believe that a healthy America, and the reason that maybe we've succeeded in bringing as much of you together as we have, is because people probably in some way, everybody is sensing it might be the right time. Enough has come together scientific evidence, cultural changes, First Lady's efforts, that there's where the engine might be primed that this could be the right project at the right time, and that there could be, this true magnifying effect. And I have to listen to my own thoughts. Why am I thinking these things? Why was I, feeling that the time might be right? But that's, it's ultimately, how do we get that in there? It's a complex process that's driven by data. It's driven by gut, and then it's driven by some kind of artistry.
Can I throw in one more thing on the empathy and what you've just been talking about, which is, I think empathy begins with connectedness. So what you've been talking about in terms of getting to local communities, getting organizations where those connections are beginning to be made already and tying into that, that's one cut. The other cut, when John talks about a whole variety of media platforms, there's a different way of looking at this whole country, which isn't state by state, city by city, it's by demographic, by demographic, by demographic. And increasingly the marketers are looking at this, and they're establishing that kind of connectedness and that kind of empathy connection, believe it or not, in the service of cigarettes, guns, whatever you want to call it. And I think that the right kind of platform mix can enable us to work at that crosscut as well, and building connectedness, and therefore leading to empathy, and therefore leading to different values.
Pat, you're going to be the last question.
Thanks. I'd like to make a pitch for the people who are not in the health space, because in my movie, A Healthy America requires higher levels of literacy, better housing, all of that. We know as funders that a number of our colleagues who are very interested in education don't think they're dealing with health. I actually don't think we need to convince them necessarily that they should, but there need to be some messages for those sectors so that they understand how they can play in this space. And if we think about it only as a chronic disease effort, you're going to lose a lot of people that could otherwise be advocates, if not funders.
Thank you. It's a really important point for us to keep in mind, and a great reminder.
Sorry, I understand you've been waiting patiently. Sorry.
That's okay. First off, I would like to applaud the partnership as well as everyone in this room for coming forward. I actually am one of those marketers and advertisers who have been working on public health campaigns for 25 years. I'm with Ogilvy Public Relations, and in DC we do, and I've worked on every chronic health issue for CDC and NIH over the years. In fact, I've talked myself into having every single one of those along the way. But one of my frustrations over the years was the lack of funding available for communications. And because I have my brothers and sisters in New York working on all of the top 50 brands, I always felt like the poor stepsister. And I believe, John, that it is a confluence of events, that this is the moment, because I believe that the foundations, obviously those in the room, really do understand the power of communications, the power of creativity to move an issue. And I think that this surround sound type campaign that will come with folks like all of the public health professionals, the marketers, the creatives, will only actually make us a healthy America. So again, I just applaud all of you, and I'm very, very excited to finally feel like Cinderella.